So think about the literal meaning or the literal structure of the word caregiver. Two words. What's in the other side of being a caregiver? What is the other party of these relationships?
Care receiver.
Care receiver, exactly. And receiver is not a very active role. It is not an engaged patient. Receive is a very, very passive role.
Right.
So we need to change something in this relationship or how we think about our role in these relationships. We have studies showing that quality and safety care is achieved by an active patient and that patient outcomes are better. When patients are engaged in their health care, it can lead to measurable improvements in safety and quality. What is currently missing in these relationships? The differences in belief system about what makes quality and safety. So providers tend to focus on the clinical aspects of the care, while patients and family members focus on interpersonal interaction. We're educating, informing, activating, and engaging individuals. I don't know what you're thinking about when you're reading all those words, but when I see that, there's the party in my head because this is exactly coaching. Coaching is the process of helping another person perform at the peak of his or her abilities. It starts from the assumption that people have the answers and that the coach's role is to help them to overcome internal resistance and interference, give feedback on behavior, and give tips and guidance. So can we lead toward the recovery goals? Can we work and make a plan, a strategic plan to lead toward recovery goals and not focus on the pain and the loss? Can we assume the competency? Yes, maybe there is a pathology, a disease, a condition, but can we assume all other competencies that our patients can rely on the way to recovery? Can we give up on the authoritative position of the expert and see our patient as experts in their own lives? They know their model of the world, they know what's their belief system, they know their fears, their challenges, their strengths. Can we help see them as experts in their own lives? And can we establish partnership with the patient? And the last thing is, can we develop accountability for the process? One of the very important roles of the coach is to hold the client accountable to her process, to the steps needed to be taken in order to achieve those desired goals. Can we stimulate and help our clients, our patients, be accountable for the process, which is what I see as the highest level of patient engagement, when they take ownership on the recovery process, right?